That's what we feel, because we feel that a lot of pet parents, they really want to treat their dog and cat as best as possible, the longest as possible. And we see that the need for these kind of therapies is becoming bigger and bigger.
What is palliative cementoplasty for osteosarcoma? And how is Biocera-Vet helping restore mobility and quality of life to animals suffering from osteoarticular conditions? Find out on this episode of Tripod Talk Radio. Thanks for tuning in. You'll find the video for this 108th episode of Tripod Talk Radio on the Tripawds YouTube channel. You know, we always like sharing news about cutting edge treatments when it comes to limb loss for our pets. So we're very excited to have two osteoarticular disease experts with us today from TheraVet. That's the maker of Biocera-Vet, which is the next generation bone substitute now being used in unique veterinary orthopedic treatments. Julie Schurgers and Fanny Guillerminet are going to help us understand arthrodesis, corrective osteotomy, palliative cementoplasty for osteosarcoma, and other ways Biocera-Vet is helping restore mobility and quality of life to animals suffering from debilitating osteoarticular conditions. Now, that's a lot to consider. So let's get started. Thank you both and welcome to the show.
Hello.
Yes, thank you so much.
Hi, and welcome
today.
Likewise. You know, I first heard about all of the treatments that your company does in a press release that came out after a study. The study results were announced on dogs with osteosarcoma who were treated with Biocera-Vet. So we'll talk about that in a minute, but let me see, Julie, can you give us a little bit of background on the company and how it got involved in the veterinary community?
So actually, TheraVet is a company that was put up in Belgium a couple of years ago. And the company is developing themselves, producing and developing all kinds of clinical trials specific for medications for dogs and cats with osteoarticular diseases. Osteo means bone and articular means the articulates. So that's what this TheraVet is doing.
And it's a spin-off of technologies from the human medical industry, correct?
That's correct. So actually our boss, Enrico Bastianelli, it's his second company he's founding. So the first one was bone technology, and it was bone therapeutics, and they were still developing bone therapies for humans.
And these have proven successful in human cases, and now we're applying them to cats and dogs.
Exactly. That's what we feel, because we feel that a lot of pet parents, they really want to treat their dog and cat as best as possible, the longest as possible. And we see that the need for these kind of therapies is becoming bigger and bigger.
Definitely. And we love that there are companies like yours giving us more options when something like osteosarcoma happens. So the basis of your products is a procedure called cementoplasty. And Fanny, can you give us a little bit of background on that? What exactly is it?
Yes. So, and once again, cementoplasty is a procedure which has been developed for human. And so nowadays we're using that technique, which is commonly used for the human practice for the veterinary field and for the dogs and the cats. So the technique itself, when you have an osteosarcoma, that creates a bone cavity inside the bone. And that cavity is going to fragilize the bone in general. So the patient is going to feel pain, is going to have some limping, and as well is at high risk of what we call pathological fractures. So pathological fractures is just because the bone is fragilized. You can have a fracture after that. So the idea here is to fill that bone cavity with a cement. So Biocera-Vet is a paste, and once it is injected inside the cavity, it's going to solidify, and that is going to reinforce the bone, is going to provide some bone structure. And that is going to help the dog feeling less pain, first of all, but as well is going to reduce the risk for pathological fracture, is going to improve the quality of life in general, and is going to reduce the limping of the bone of the dog as well.
So this is not regenerating bone, it's actually replacing bone in those cavities and strengthening the area where it's being eaten away, per se.
Yes,
yeah,
exactly.
First instance, it's giving like extra strength to the cavity, as Fanny says, but in later instances, we saw also that the components of Biocera-Vet are replaced into bone. So we see there's also some replacement there, but the main effect is like, the strength.
That is so exciting because we have seen a lot of pet parents struggle with the decision to amputate, because their dog is a giant breed dog. They weigh over 100 pounds. They just kind of have a feeling that their dog might not do so well on 3 legs. So they wait a long time to decide whether or not to amputate. I can't blame them at all. And then the dog has a fracture, and then they're forced to amputate or euthanize. And it's a terrible situation. So I love that there is this option. Before you started using it for osteosarcoma, it was used in other veterinary procedures?
Yeah, so it's not before or after. Biocera-Vet is being used currently for 2 different indications. An indication that we call add-on bone surgeries. So this is for example, when there is a bone surgery such as TTA or osteotomy. If there is some bone cavities created during the procedure, it can be the veterinarians can use Biocera-Vet to as well reinforce the bone, and is going to use Biocera-Vet as a bone implant. Biocera-Vet is going to help solidifying this area, and as was mentioning Julie, is going to little by little being replaced by the natural bone of the patients. The second indication is the osteosarcoma, which we've been talking about today.
So could this be considered a limb sparing procedure, which have traditionally been with fixators and mechanical devices?
Actually, I think that all is about the diagnose. So it's the vet that really has to put like a very good diagnose and looks what the best treatment is. I think it's important to state that Biocera-Vet has a very nice effect on the quality of life, but it still remains a palliative effect. So actually Biocera-Vet is not treating the cancer. So what very often happens is that the vet will make a choice for a combination of different therapies. So it will be chemotherapy, or it will be anti-pain medication, or an extra surgery, whatever. But now what the good thing is that with Biocera-Vet, we're adding an extra option in the treatment of this terrible disease.
So Fanny, I'll throw this question at you. So can this treatment be used in conjunction with, let's say, radiation therapy and bisphosphonates?
Yes, absolutely. So the treatment can be used alone or in addition to any other treatments like the one you mentioned. It's really at the choice of the veterinarians.
That is really good to know. When did the company realize that it could be used for osteosarcoma?
Actually, as Fanny said already, the cementoplasty, so filling the bone void of someone with cancer, is a technique that has been used since several years in the human environment. And actually, there was a vet in France, and he still is. It's Professor Gauthier from the University of Nantes. And he thought about this technique, and he has tried it out in a veterinary environment. So he's the one that took the step to transport or transfer this technique from humans to dogs.
Let's see, Fanny, when did this, there was a clinical trial that went on. Where was it done? And can you tell us a little bit more about the trial?
Yeah, sure. So the trial was performed with more than 6 different clinical sites in Europe, either with private clinics or universities in Europe. 15 patients were treated during that trial. And we did find very interesting results. So first of all, when we analyzed the data at the end of the study, so the study duration was 6 months, by the way. And when we analyzed the data at the end of the study, we show that there was indeed like a bone support provided by Biocera-Vet of the bone. And there was a lower incidence of fractures for the patients treated with Biocera-Vet, but as well, the orthopedic surgeons reported that there was less pain felt by the patient, and most of all, there was better quality of life reported by the dog owner.
Yeah, yeah, sorry.
Oh no, I'm sorry, Julie, you go ahead.
No. I really want to, I would like to add something to that because it's such a fantastic story. So actually one of the animals that has been treated, one of the dogs that has been treated by cementoplasty, when he woke up out of the surgery, quite fast, he stood up and he started peeing. And he was peeing on 3 legs and with 1 leg up, which was amazing because before the dog was in so much pain that he would never have done that. So the effect on pain is really fast. And we see it also in the study because we had questionnaires also for pet parents and vets. And we see that the effect on pain is amazing and very fast.
That's so hopeful because anybody who's dealt with osteosarcoma in their dog knows what that limp is like and holding up the paw because they're in so much pain. So that is super exciting. I'm curious if either of you could tell me, were specific dog breeds chosen for the study?
No, Julie helped me with that, you know, but there was no criteria on the breeds of the patients. There was a high diversity of
yeah, but I think that, yeah, the dogs had osteosarcoma. So actually it's more the bigger breeds that are a bit sensitive to that. So actually we're in that population, yeah.
And Fanny, I understand this is now available at clinics in the United States, correct?
No,
It's
so
not.
actually not yet, yes.
Not
so,
yet.
But we're working on it. So
that's why we're getting people the word out too.
Yes. Right now, we are planning to commercialize a product in the USA for this coming May. So in a few months, and that is
fantastic.
Very exciting for us. Yes.
So I wanted to ask, are there specialized training or specific types of doctors that can do this? Can we learn a bit more about the actual procedure? Is it surgical to get that in there?
A little bit. So it's pretty specialized. So the procedure itself can be performed by any veterinarians having some orthopedics background or surgical, medical oncologist as well. It's still a bit a specialized technique. So I will say if any of the listeners today are interested, they could reach to their veterinarians and check with them if they're used to that technique, if they would be willing to learn more about that technique.
Yeah.
That's really, really cool. What about cats? Because I know osteosarcoma in cats is super rare, but because we're such a specialized community, we tend to see it at least a couple times a month. So do you think there's plans to try it with cats?
Yeah, sure.
Yeah, actually there is no reason why it shouldn't work with cats. So the Biocera-Vet for bone fractures is used in cats already. So for in that indication, we already have several cats that have been included and everything went well. With osteosarcoma, it's like you say, in cats it's much rarer and we don't have the occasion or the opportunity to test it out. So yes, I think theoretically it's possible, but we haven't had any cases yet.
Okay, good to know. Julie, do you think that there will be more trials in the US or will it just go straight to market in May?
I think that's Fanny is best to answer that one. She's clinical US expert.
Okay.
I'm working on it. Yes. So yes, we are currently actually talking to orthopedic surgeons here in the USA, once again, some surgical and medical oncologists, and we have some veterinarians on board with us to do some clinical cases in the USA.
Oh, great. Can you tell us where?
Well, we often see these things roll out through veterinary teaching hospitals.
Yeah,
so are there like
yes.
Colorado State or Davis getting involved to where people could go and
NC
ask about it?
State?
So because it's not finalized yet and we're in the process, if I could like not
Understood.
giving any names, but yes, it's actually a bit of both. There is a lot of course, and the big universities are the best to be working with to develop techniques, and they have so much support and so much good feedback in the research program in general. We do work as well with some private clinics, however, that are really fantastic to work with as well.
So we certainly understand the privacy concerns and the confidentiality things, but anyone listening, feel free to reach out to your local veterinary teaching hospital or veterinarian orthopedic specialist to talk to them and ask them about if they've heard about Biocera-Vet.
Yeah, and thank you for saying that. And that's actually a good point. If there is any as well veterinarians listening to us today, feel free to reach to us if you want to know more about the techniques or even organize some clinical cases for us. That would be fantastic.
Ah, okay.
So are there existing studies or papers out there on the product that those vets could then access?
Yeah, we have actually 2 studies published, one on bone surgery and one on osteosarcoma. The last one is not published yet, but the first one on bone surgery was published as a poster at a big vet congress, very recently in February, and Fanny was there to present that. So that was on bone surgery. For osteosarcoma, we have a study we can share, but it's in the process of being published.
Fantastic. Okay. So could you remind our listeners of the website? Is it TheraVet?
Yeah, for the time being, it's www.thera.vet.
That's
and
right.
Then in a later stage, and I'm talking about, by the end of March, we will also have a more specialized website with more details on the products, which will be called www.bioceravet.com.
Very good. So biocera-vet.com for anyone listening. And for now, thera.vet has a wealth of information.
Yes, exactly. Yeah.
That's terrific. This is so exciting. And we hope that it just, everyone learns about this so that if they're dealing with osteosarcoma, it's presented as an option. Thank you so much, Fanny and Julie, for being here. We really appreciate this.
And we'll be sharing some of the stories and the case studies of these on the Tripawds news blog. So stay tuned for that.
Thank you so much for your invitation today. It was a pleasure talking to you.
Yeah. It's been fascinating. Thank you.
Thank you for spreading the good news. It's really helpful, I think, for pet parents, vets, and everybody. It's of real help. Thank you.
And thank you both for joining us.
Thank you.
Many thanks to Fanny and Julie for the exciting work they're doing at TheraVet. Learn more about BioceraVet at thera.vet and find all Tripod Talk episodes at tripawds.com/radio.